weeks, it is Heart Month, so Dr. Erica is here visiting with us to talk about, of course, the heart. And you're going to explain some problems that might arise and exactly what's happening to the heart when it happens. So let's start off with the first and foremost thing, heart attack.
Heart attack. So here's a heart model, right? This is the outside of the heart, obviously. This is the front of the heart. This is kind of how it would sit in the chest. A heart attack, as you can see, this is the arteries that are feeding the heart muscle. So the heart needs blood, just like every other muscle does, and the oxygenated blood comes off of the aorta here and feeds the heart. So these are the coronary arteries that if someone were having a heart attack, these are blocked, these red lines going down the heart. This is the left anterior descending one, which we call the LAD, or sometimes people hear the widowmaker or the left main that's up in here because it feeds such a large area of the heart. And the left circumflex comes around and feeds this part of the heart, and the right coronary artery feeds down here. So if there's a blockage in one of these arteries, it's not feeding that part of the heart, and that part of the heart is going to be damaged. And the extent of that damage depends on how big of an area that is or how their heart is to start out with. But it may not pump well, or it may go into a bad rhythm, or they may have sudden death with a heart attack. So these are the coronary arteries that are responsible for heart attacks that you need to get in and get a stent if you're having any chest pain, saying that there's not enough blood flow when we're working that heart, getting to some of these parts of the heart where the heart needs to do its job.
All right, now let's talk about murmurs and heart valve disease.
So people a lot of times say, oh, I've always had a murmur, someone's heard a murmur on me, but they say it's not a big deal. And then some people you hear of bad murmurs, mitral valve, the aortic valve. So the blood, just a little quick anatomy here, the blood comes into the heart through the superior and inferior vena cava into the right atrium right here. And it goes from the right atrium, which is a chamber, down into the right ventricle through this valve, which is the tricuspid valve. So the valves are the little connectors between the chambers in the heart. And as the heart is squeezing and relaxing, they're either open or they're closing so that the blood can be pumped the right direction through the heart. Over here, in the left side of the heart, you have the mitral valve. And the right side of the heart pumps the blood to the lungs, so through the pulmonary valve right here. It comes back into the heart through the left atrium and the left in the pulmonary veins, into the left side of the heart and through the mitral valve into the left side of the heart, and then into the aortic valve, which you can see up through here. So if these valves are not closing all the way, if they're leaking, if they're too tight, then it's impacting the flow of the blood, and you hear turbulent blood flow. Sometimes it's just a little bit of a leak and it really doesn't make a big difference. Sometimes it's a big leak and it can make a significant difference and needs to be surgically repaired. So these are the valves, these little tissues in between that separate the chambers of the heart.
Wow, well, Dr. Erica, thanks for explaining all that to us. Cool little toy there. Makes me want to become a doctor just so I can play with something like that.
Yeah, anytime. Get one for your kid.
Yeah, exactly. We'll be right back after this break.